Hello everyone, this is Dr.Din at your service, and Dr. Sood is here, who also to accompany me with some questions and answers that we are going to be answering today. Let me tell you what Dr. Sood does and has done in her life. So basically, both of us are medical doctors. We are in New York. We practice in New York. I am board certified in family medicine. She has done internal medicine. However, both of us have one thing in common. We have done anti-aging, and we have actually done anti-aging for a very long time. She has had her own practice. I've had my own practice. We kind of work like close to each other, so we kind of collaborate all the time also. So because we were early adopters of anti-aging, we have a lot of experience, and so it was fun to have her join me, where we spoke about some important procedures. And we have a lot of people asking different questions because during the pandemic, one good thing that happened was that everybody had to stare at their own faces for a long time, and we get a lot of questions because people are seeking non-surgical, minimally invasive treatments that help them. So we are basically going to be answering some questions. However, one of the things that I really want to talk about is a lot of our clients talk about and want to talk about what we do for weight. And it is summertime. We are always helping people try to reduce their weight, release their fat, and keep it off. And weight reduction and weight maintenance is a very, very important part of anti-aging. If you cannot maintain your weight, it is going to be very difficult for you to do anything. Anyway, so one of the things that I recommend for people is something called cool sculpting, which is a targeted fat reduction in certain areas of the body. It's really actually one of our clients is getting cool sculpting right now, and if she allows us, we should be able to actually show you as the applicator turns out. And so that is a treatment that we do for targeted fat reduction. And guess what? Around this area, around the midriff, if you sometimes just exercise and just some diet control you may not be able to remove that weight.
So you want to see
So
while I take it off?
yeah, that'll be great. So when you're doing it, okay, so guys, I'm gonna show you. All right, and this is our room, which is called Relax, but there's nothing relaxing about it because we basically do a lot of procedures over here. And this is Daisy. I'm not gonna show your face, so don't worry. We're gonna only be showing but we can I want to see. So she's doing a very large cycle, so you can see, wow, that's her frozen fat blob. Say goodbye fat. So now after she removes, so normally with one treatment you can see maybe 10% to 15% of fat reduction in that area. However, this is the only area she wants to remove. So she basically, she's already gotten 3 other cycles. We treated her full stomach. This is her last one. And then we are going to be doing, and so she massages it for a couple of minutes. And then we did an IV infusion on her also. How painful was it? I'm going to just show my face now. How painful? So it is not painful, right? No painful. So not painful. And that was the treatment. And usually we basically recommend a few treatments and sometimes we also recommend a little bit of a diet protocol with it. This client wants to give herself a kickstart or a jump start for like maybe for 15-20 pounds before she goes on her vacation. And this is a great way to reduce the weight, but in a targeted way. And than to keep it off also. So again, that was our question about the weight reduction that people ask. However, this client also did something called an IV infusion, which is a vitamin infusion. I consider it like an oil change for the body, and works beautifully. We give some really nice water-soluble vitamins, and if you've not tried those things, please try. Now they are increasingly becoming available all over the place because people have somehow realized that as we get older and we're living longer and longer, how about living well also as we live longer? And some of these treatments, instead of just waiting for some disease to develop, we can also choose to live with the mindset of, maintaining ourselves. And this is what anti-aging and aesthetic anti-aging, what it means to me. So a lot of our clients were asking questions because we get like a lot of phone calls, we get a lot of questions asked on different social media platforms that we go on, and we've been on for many years. And so I have decided that instead of it's almost impossible for me to see my patients and then go and have virtual consultations with all of the people who call us in a day, but I can always come over here and answer as many questions as I can, and then you guys can, at your convenience, come and see the answers on any one of our social media sites. So I have Juvanni Medical. I also have the Real Dr. Juvanni account, and I also go live because I know how to go live on my Facebook. So I go live all the time over there. So you have the questions.
She's like a little child that has finally figured out how to use social media.
I am a social media addict.
Yes.
I am a social media addict.
So first of all, I would like to just acknowledge the fact that I'm so appreciative of all the kind people who've come into my world, Dr.Din included. The amount of kindness that I've been shown just because she knew that I was in, I lost my brother. We've had these conversations already.
Yes.
But I've been really loved and pampered unnecessarily. Like, I'm so grateful for these good people in my world. Thank you. She's a very close friend of mine. We became very close friends over the past several years. And I just feel bad. She's, the pandemic has been so bad and has so difficult. It was a rough period for a lot of people, and especially her. She had personal tragedy in her family. Her younger brother passed away, and life was hard. However, I see that she's coming out. She's beginning to look after herself, and that's what life is about. No matter how hard things get, how rough life is, you gotta pick yourself up. You gotta do the correct thing for yourself, and sometimes doing the right thing is not easy, and that doesn't mean that we don't do it, right? Yeah.
So you still we'll mourn, we'll grieve, but then we'll also look up.
But one should be lucky that you have good people around you,
Yes.
And so hitting that whole thing about the weight loss and whatnot. At the end of the day, look, what is that? You can lead a horse to the water, but you can't make him drink. We can do everything you need. Make your face beautiful, make your body beautiful. But if you're not accountable for your own health and your own well-being, like even with the Cool Sculpt, you still have to eat well, move your body. Mm-hmm. You can't think that it's going to be a miracle. Mm-hmm. It can be a miracle, but that's all on you. So
absolutely, so none of these things are miracles. However, even God, if God had to come and fix things, has to follow the laws of physical universe, especially when we're living in the real world. However, let's answer a few questions, because the philosophical questions will always remain. However, these questions are anti-aging questions, which is the reason that I'm here. that we are here. So I will ask certain questions, and I am going to have Dr. Sood answer some questions, and then I will answer some.
Spot, but hey, I'm ready. I'm ready for it.
She was born ready. You're born ready. Okay, so the first question is, what is the difference between Botox and fillers?
Okay.
It's a very basic question. And it also is followed by a follow-up question, which is, how long does Botox and fillers last?
Okay. So now if you're asking me that question, now you're talking apples and oranges. Botox and fillers are a similar animal, but they work in different ways. Botox works on dynamic muscle movement, right? So what the goal with Botox is to stop the movement, to kind of preserve those muscles and give you that youthful appearance. So fillers are simply that with static movement, that you're just filling in a space that has been diminished, depleted.
So volume
replenishment,
yeah.
yes. So that's the basic difference. Now, when it comes to Botox, in an ideal patient who's either very young or has been doing Botox, the lifespan of
Let me wave to everyone. Okay, yeah, please keep
the lifespan of the Botox is going to be between 3 to 4 months. If you're a beginning patient, it's going to be different depending on how you present, you know. Fillers, realistically done correctly, fillers will last you easily 6 months. Done correctly. I mean, I don't know. You can put your 2 cents in on that one. But I feel like that's the main differences, and the price point is different as well. So
she's right. So Botox is basically and I've written a book about it. It's called "Do We Really Need Botox?" And it was in 2019. I wrote it, and you can find it on Amazon. Basically, I put it out as FAQs. So if you have any basic questions about why you should use Botox, what is Botox, what is the history of Botox, why we use it, how we dose it, that is something that's there. But I basically, let me recap a couple of things. I totally agree with what she said. Botox is something that you use in the dynamic muscles of your face, which are usually your forehead muscles. Sometimes we use it on the chin also. However, and sometimes you use it on the jaw muscles because of for TMJ pain, but also for face shaping. However, Botox is something that relaxes the muscle so that your muscle doesn't crunch that much, so you do not develop that many wrinkles, because a normal human usually moves their brows at least 500 to 700 times a day. So over a period of years, you just your skin is like a fabric that covers your face. So then those wrinkles start getting created.
So if I could just intercept and just say, if it can be more relatable to people, is that, for example, like when you're moving your muscles through the course of life, it's kind of the same way as when you work out, right?
Yeah.
The older you get, the more your muscles will accommodate to your anatomy, correct?
Yeah.
So if we can knock that muscle movement out, it's kind of like if one were to get I hate to put it this way, but if you were to get a stroke, if one side of your body is not working and the other side of the body is still working, like the more you work it out, the more that muscle is going to get powerful, right? But with the Botox, you knock out that movement. So it's kind of like, you get that...
a smoother appearance.
Yes.
Basically what happens is that, so what would be a better way to inject? So one of the things that why would somebody's Botox not look nice? Like why it happens that somebody gets injected and they look like clowns and they can't move their foreheads, they have like this one fixed look, frozen face, and or they do so little, and they do, because you don't understand Botox. Not everybody can do Botox correctly. You have to initially people make a lot of mistakes. However, one of the ways to for sure make Botox look bad is to do too much of it.
So I tell people that Botox
Less
has
is
to be
more.
the less is more is always the case. Also, one other thing is fillers. How much filler can you put in your face? I tell people again, use it very moderately, because if you use too much filler on your face, eventually you start looking really fake and phony, and sometimes lumpy and bumpy over a period of time.
And don't say Dr. Din or Dr. Sood did your face, please. Like if you're overdone, you look natural, look beautiful.
Yeah.
Correct?
No, we don't. Like my thing is that I again feel that people should do it once or twice a year, and do very little of it, and also combine it with other treatments. So you can combine, if you're in your 30s, you can combine Botox and fillers with some microneedling with RF laser, which also gives you a little bit of tightening. However, it doesn't give you that much of a lift. But at 30, in your 30s, you don't need that much of a lift. Only a little bit of skin tightening would do well. However, when you get into your 40s and your 50s, late 40s, late 50s, that's when skin sagging begins to appear a little more. That's when women tend to inject a little more in their face, and that's when they need to hold back and not inject that much. However, you should still do a little bit of skin tightening. At that point, again, I say combine it with the machine. Combine it with all therapy, with microneedling with RF laser or something. Just microneedling is not that great. I'm not a big fan of that kind of microneedling, because it doesn't really do that much. It's just very topical. It's an adjunct to everything else. So that's what I feel like. Botox. So filler is totally different. Filler is like collagen. Filler is for volumizing. Why do we need volumizing as we get older? As you get older, your body stops producing collagen, and little by little, every year, even if you lose like 1% of collagen from your face over a period of years, or a decade or something, you will start noticing hollowing in certain areas. Now that is the collagen that we can replace. There is no other way to replace it unless you inject it. You can eat all the collagen in the world. It's not going to get absorbed from your gut and travel through your veins and land in your wrinkles or land in your under eye. That's not going to happen. So one of the ways to replace collagen is replace volume in your face and bring your youthful looks back is to give you a tiny bit of collagen. However, it's supposed to be very little, and it's supposed to be to make it look natural and not phony and fake. You have to do a little bit of skin tightening with it, and that's what we recommend. Sometimes what I've like now, because I've been doing this for so many years now, that I have created small packages, which I know that everybody will have to do all of these things to get to the result that they're desiring. So most of my clients just come and purchase those packages. So try asking for those. Now, the follow-up question for that question about Botox and fillers was, how long does Botox last and how long does collagen last? So it's again different. It can vary from every decade of your life. In your 30s, things that you place in your face in your 30s can last for up to 2 or 3 years. When you place fillers in your 40s or 50s in your face, it lasts very little time. Maybe 6 months if you're lucky, 8 months if you're even luckier. But I have seen people who lose, it just disappears. Their metabolic rates are still very high. So I would say that every year you gotta replace collagen, and maybe twice or thrice a year you should also put a little bit of Botox to relax your muscles.
Depending on the individual. I mean, sometimes if it, like, look,
men usually come once a year. Like I have so many guys who come in for their anti-aging, and guys like to do it once or twice a year at the most, because they're usually very busy, they're usually working, and they don't want to be looking overdone also, so they kind of like just maintain and preserve their facial architecture without really going overboard. However, women like to look as perfect as possible, so that dynamic
we have to understand. So
the misconception is that you have to come when you're very elderly and looking very old.
Yeah.
I mean, we've been doing these procedures like since my mid-30s.
Yeah.
And I have to say, I mean, the reality is we have good genes too. I mean, we eat well, we have good genes, blah, 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 whatever. But when you start, the earlier you start, the more you're going to be preserved. And that's just, and then you don't have to do as much. You don't have to do as much quantity.
Yeah.
And then I have done a procedure, and I've been through a real rough year. Maybe one time last year, and then I just came for you to torture me with the oil therapy. Yeah. But I mean, if you start early, so these are the things that we talk about when you come in, like to help you understand. We're talking prevention, not just treatment.
Yeah. No, and actually, it is better to be able to prevent these things from happening. Okay, so the next question that I have is by Dominique. She's asking, what is the difference between AquaGold microneedling and microneedling with RF? So we do both. I have AquaGold also, and I also have microneedling with RF. We have the Genius. So AquaGold has it's like a stamp. It's like a small container which we put all the stuff in, whatever we want to put under the skin. So AquaGold is for those people who have realized that regular foo-foo facials is not the way to restore the skin sag or texture. So they have understood that somehow or the other we have to create a channel so that we can put the product under the skin. So AquaGold was a way that was designed as like an outpatient, like a quick procedure to put like sometimes a little bit of collagen, sometimes a tiny bit of Botox we can put it in, and we can mix it, and we can, you don't even need that much numbing, and we just put it. It just gives you like a nice appearance. It's like a facial. It's like a very good quality facial. However, it's not, you have to do AquaGold maybe like 3 or 4 times to see how, see the impact that it can create for you. It is one way to deliver stuff under the skin. However, the microneedling with RF laser is like microneedling on steroids, as some people are calling it. But anyway, so that is something that creates a very nice channel like into the skin, and the RF laser creates even smooths out that entire channel. And then we sometimes can put stem cells in, we can add different serums and stuff, and that stuff will go through that channel into the skin, and people really like that. Also, the RF laser creates a little bit tightening and lift, which is great for women and men of all ages. So
you do that for my hair, no?
So yes, so microneedling again. So microneedling, when you do the RF laser, so the laser that I have, it is also used for the scalp. For hair loss, we use it for men and women, and I've done it on her. Let me go to the next question. I hope that answered Dominique's question, but if you have any other questions, follow-up questions about that, please call us back once you hear this talk, Dominique. And also, there is something funny I say about AquaGold, and I say that AquaGold is for those people who cannot afford the microneedling with RF. And it's like, it's like when you're trying to do the right thing, but you don't have the cash for it. So that's it. But it will do something, but it's not going to do the whole thing. So if you can afford it, do the one with RF. Okay, so the next question is Nadine. She is saying that she received chemotherapy last year, which accelerated her menopause and now has abdominal fat. What would you recommend? Again, Nadine, if you see the beginning of this video, you will see I showed cool sculpting, and I was also talking about HCG, which you can combine with cool sculpting. However, you cannot do HCG because you just had chemo, but cool sculpting by itself is something that you can totally try. It's safe. I've done it on a lot of people, including myself, and it really works very well. So give it a shot. The next question is Kanika. Just turned 40 and everything is changing. Her skin is breaking out. She is getting she has been getting microneedling somewhere else, but she's still breaking out. Her skin is now dull and dark. What would I recommend? Again, so Kanika, thank you for your question. I'm glad that you're turning 40. That's very cool.
God bless you with
God
40
bless
years
you.
on this earth.
Listen, Kanika, remember, in the 18th century and the 19th century, women used to eat well, do whatever they could. It was organic, natural living, everything. And they used to still die at the ripe old age of 35 to 40. However, in the 21st century,
10 kids.
after having whatever amount of kids that their bodies could handle. And usually they would die during childbirth. But now, thanks to birth control, thanks to modern medicine, we have doubled our lifespans. But we not only as we double our lifespans, we also have to make sure that we preserve the quality of our life and preserve the architecture of our faces and our body function for as long as we can, because nobody wants to be totally useless and just fighting dementia and be dragged around in a nursing home for the last 10 years of their life before they die, before they're allowed to die. So, that is the reason that it is imperative for women to start looking after themselves the moment they start feeling the decline happening. And around 40, you will start noticing the decline happening. And as you end that decade and you start hitting 50s, you will see that the decline is sharper. So definitely, if you are feeling a little lusterless skin and this and that, and you're doing microneedling, and microneedling is not going to do shit because just microneedling will not do shit, then one of the things I would recommend to you is to try maybe a microneedling with RF, and try it with one of our vitamin IV infusions. I also recommend a little bit of Botox and filler. I've not seen your face. Maybe you should text us your picture so we can see what is it that I can help you with. However, I do offer laser skin polishing also, but we don't do it in the summertime. So since summertime is right upon us, once I look at your skin, we can figure out what are the things that you can do at this time safely, because laser and skin polishing is a very big possibility, but I recommend it during the winter time. Kanika got a hernia operation and her stomach looks messed up and wants to know if cool sculpting will help. Dude, show me a picture.
Yeah.
I have to look at it. And yes, we have a lot of treatments for non-surgical fat reduction. I'll look at it. If it is possible, cool sculpting you cannot do right after surgery. However, after a year or 8 months of surgery, you can do it. It depends where the scar is, what kind of surgery, how is it. And if there is muscle, the muscle is not, it's fallen apart and stuff, then you gotta do something else. Cool sculpting may not be the right thing for you. Please send us your picture and I will let you know. All right, guys. Goodbye and good night. We're done with our work. And oh my God, it's 8 o'clock. I gotta go home. Bye. Bye.